Hi, my name is Heather Macchietto. This is my presentation on gender differences in older adults, mental health, utilization, and suicide risk. This is a literature review for Sociology 53-57, Gender and Aging. There is a misbelief among older adults that depression is normal. They may also fear that something really is wrong, and so they hold off in seeing a provider for that reason also. There is a lack of knowledge regarding psychological disorders and their treatment. Even among family members are often unaware that this is not normal aging. There's a misbelief that treatment won't work in older adults, that maybe they're getting forgetful or they're not good candidates for therapy, but that's not true. They have found that for short-term cognitive behavioral therapy, it works just as well in older adults as it is in younger adults. If we leave depression and other mental illness untreated, it is associated with a poor quality of life, a failure to follow the doctor's orders, and even having heart disease and diabetes. So those of us who work with older adults are going to have to understand how to recognize the symptoms of depression and especially of suicide, and what those signs look like in older men or older women. There are quite a few gender differences when it comes to mental illness. In terms of stress, even men and women display stress differently. Women are more likely to report that they are feeling stress. They're more likely to reach out for help. They aren't as afraid to admit that there's a problem. Now, it has been shown that women have a greater likelihood of actually experiencing depression due to stressors in daily life. However, it's the men who are going to suffer in silence. When it comes to depression, men worry that if they ask for help, they will seem weak, they will seem less masculine, and so you run the risk that the depression won't be treated. And then when it's untreated, in men specifically, we see a withdrawal from other people. They're less likely to do activities and be around people, things they've enjoyed. So this has a very strong impact on men because when they're lonely and they're not connected with other people, they show a low life satisfaction. Suicide. Older Americans make up about 13% of the population, but they account for 18% of all deaths by suicide. And depression is the major risk factor of suicide. Older adults are more likely to die as a result of the suicide attempt, and suicide in older adults is primarily a male problem. Men tend to use a very lethal method. They tend to use guns. This is final, is more likely to be effective. Also, older adults, men specifically, they're more likely to be living alone. And so there is less likelihood that they may be discovered or that they may be rescued before they die. Women, on the other hand, a suicide attempt is typically seen as a cry for help. But with men, they use a more lethal means, and we know that for men in particular, having access to a lethal means is a major risk factor, and 80% of suicides by men older adult men, were done with a gun. Other causes of suicide, we look at finances. There's an expectation in men that they should be the breadwinner. They should be the one that is providing for their family. They're the head of the household. They're the strong leader. So when it comes to men, financial security is more important for their well-being as they get older. And it's harder because they're retired, they're living on a fixed income. They may not be able to afford everything that they enjoyed in the past. In addition, a lot of the literature mentioned over and over feeling like a burden. Older adults do not want to feel like a burden on their children or their family. And so if they have physical illnesses or if they are also caregiving for someone, they're more likely to become depressed or suicidal. When somebody is a caregiver, they are more likely to suffer from depression. So if a older man is being cared for by his spouse, she may develop depression, and then he in turn could also become depressed because he is feeling like a burden on her. I read a very interesting article on physical illness and cancer diagnosis and how that affects the mental health of older adults. And for older adults with cancer, the greatest risk of suicide is within the first week after they're diagnosed. Obviously, no one wants to feel like a burden, and needing help with ADLs or taking care of finances, shopping, etc., causes a great burden on the older adult. Also, it's interesting to notice that medications also cause depression. Many older adults take medications such as statins, beta blockers, corticosteroids, and these medications can cause the side effect of depression. Over and over again, the literature kept coming back to the fact that physicians must know how to assess and diagnose suicidal ideation in older adults. The more illnesses that someone is going through, the more physical challenges they have, the greater the risk of suicide. Sometimes those illnesses cause the older adult to have to move to a nursing home. And the study that I read found that it is women, when they get into a nursing home, that are more at risk of becoming depressed in the nursing home. When it comes to shame and stigma, we know that there is a stigma regarding mental illness. And this prevents many older adults from seeking treatment, especially when they were growing up. It wasn't talked about and discussed and understood as well as it is today. So this is something that we as professionals working with older adults need to help change. A lot of older adults want to deal with it privately. They think they can handle it on their own. I read an article about rural adults, specifically older adults in rural areas, and they feel even more self-stigma about mental illness and want to handle it on their own. And there was interesting discussion about education and how the level of one's education affects whether or not they are willing to seek help for mental health issues. When it comes to masculinity, this was a lot of where the research was focused. When it comes to shame and stigma of mental illness in older adults, it's the men. They are taught that they need to be tough, they need to be masculine, and they're less likely to practice good self-care. Whereas a woman might ask for help, the man is not going to ask for help. So the man may focus internally, worrying about his physical decline, worrying about things he can no longer do, and he'll report that he feels shame because he no longer feels like a man. Men also resent being told by their family that they need help. A lot of literature cited that family and good family relationships are a protective factor against suicide in older adults. However, if a man is told by his family that he needs help, he sees that as him looking very dependent or very incompetent if he actually went and then asked for help. What was really sad in the literature is that men reported that suicide could be considered the ultimate act of assertion and heroism. And then in this regard, the man, he's making the decision when he dies. He's making the decision to end his life, and he's having the final say in the situation. When it comes to theories that would apply to this topic of mental health in older adults, the first one would be cumulative inequality. And you could argue the cumulative inequality theory because this is looking at the situations of older adults and how life changes impact them in particular. For example, we're looking at the perceptions that the older adult has of the advantages and disadvantages in their lives, rather than just looking at it objectively. Because we know that all older adults will face losses, physical loss, mental loss, loss of friends, loss of a home, but they don't all become suicidal because of these losses. So the cumulative inequality theory looks at how these changes affect the particular person. In addition, the idea of feminist gerontology is very interesting when it comes to this subject. This connects because we think of the impact of gender relations on men's mental health and chance of suicide. By doing masculinity or appearing masculine, men are being led to hurt themselves, to hurt their health and their physical safety, and neglect social relationships. So historically, with the man being the breadwinner, he was dependent on his wife for social contacts. So if he loses his social network, he has an increased risk of depression and suicide. Health professionals. There are a lack of geriatric mental health specialists. A lot of professionals have not been taught to work with older adults, and they don't understand how to be on the lookout for older adults who are showing depression, anxiety, or other symptoms of mental health disorders. So assessment of depression is very important. Also, to remember that medication management, a lot of antidepressants are untested in people over 80 years of age. So we don't exactly know how it's going to affect the older adult. And so doctors need to be skilled at how to prescribe these medications, how to monitor them, how to make sure that the older adult is taking them correctly. We know that older adults take a lot of medication. They may forget what they're taking. They may forget if they've taken it. So they may not have the optimal result. Also, when it comes to primary care providers, they tend to miss the symptoms. They focus on the physical illness. The older adult comes in to talk about their diabetes. The physician focuses on the diabetes. 2/3 or more of older adults who did kill themselves were in a primary care provider's office within the last 30 days of their life. So within 30 days of them taking their own life, they saw a primary care provider who could have asked the question, who could have done the assessment, who might have been able to stop the cycle of suicide. It is so important that we understand what this looks like. We need to develop proper screenings and proper interventions. Interventions focusing on women and their stress, interventions focusing on men and respecting their masculinity and their pride. Less than half of the people who have clinically significant mood disorders in older adults are diagnosed in primary care, and only a small minority of them actually undergo treatment. Mental health care needs to be accessible, and it needs to be acceptable to older adults. Many of them are embarrassed to go to a psychiatrist's office or to a counselor. But if there is a way to connect these providers in like a geriatric clinic and have a mental health worker in the geriatric clinic that can do assessments and referrals, that is more likely to be agreeable to an older adult. Also, when we think about other places that older adults are seen, they go to the pharmacy all the time to refill their medication, maybe get over-the-counter drugs, get diabetes testing supplies. Home health agencies, if there's a home health aide coming in, or even senior centers where you're really getting to know the people and you can spot those little differences before it becomes a full-blown suicide attempt. And these professionals can help us to decide if mental health referrals are necessary. When we think about older adults, most older adults are at risk for depression, other mental health issues, and as we've shown, most men are at risk for suicide. When I was doing this paper and researching, I was thinking about my own dad and just all of the issues that he checks off in the boxes, you know, and 75 years old, owns a gun, has multiple medical problems. And so, although we don't like to think about it, these things happen. And when I was writing this paper, a friend of mine from high school, her dad actually did commit suicide. So I feel like this topic can't be stressed enough. Even in my work with independent adults, I have several residents that have been diagnosed with cancer this year, and I take it very seriously that I continually talk to them about their mental health, how they're feeling, do they have a support system. I've even hooked a couple people up with volunteer mentors from the cancer center nearby. So I don't think that we can do too much to help being a good source of information and referral for the older adults with whom we serve. Thank you.